Assalamu alaikum. Thank you for joining us today. To start, could you please introduce yourself and explain what you do as a hearing care professional?
My name is Usman and I'm an audiologist and hearing care professional. Basically, our job is to assess and evaluate hearing problems in any age. And we only provide hearing solutions. We cannot treat the patient with medications. Okay, so this is our basic introduction, that we are dealing with only audiological solutions. And assessments like a hearing problem, and if there's any issue with any kind of hearing, we just provide the solutions for them.
Okay. At what age is hearing loss in children usually detected, and what are early signs parents should look out for?
Normally in Pakistan, usually at birth you can do a simple assessment which is called auto-acoustic emissions. We provide in Pakistan, every audiological clinics provide that assessment, like OAE is actually the test, and that is for the newborn children. This is called the newborn screening actually. So you can do it while at the time of birth.
Okay. How does untreated hearing loss affect a child's language development and learning in school?
100%. If someone is not hearing anything, he cannot develop his lingual. So if he is hearing something, he can develop any lingual. Like if you are living in China and you'll stay there for some time, you start learning Chinese language. So if you are not hearing anything, you cannot develop your language. So at a very beginning stage, like if you get the newborn screening and it is detected that there is a hearing loss, so you must go with a patient must go with a hearing solution like hearing aids, or if there is a total deafness which is called stone deafness, so that is there is a solution for them. That is a surgical procedure that is called cochlear implant. So patient with absolute zero hearing can go for that cochlear implant solution.
What kind of support makes the biggest difference in a child's education? Could it be hearing aids, sign language, special teachers?
The best is hearing aid. The best is hearing aid, because if you develop a child on sign language, he or she will remain on sign language for the rest of the life. So the best is, sooner is better, get a hearing aid.
Okay. How effective are hearing aids in helping children participate in school and social life?
Very important, very important. It's very simple. Like if a student is not hearing teacher, he cannot develop anything. So this is very important. A patient who has a hearing loss, whether in any age, he should use hearing aids. Immediately, sooner is better.
What barriers prevent families from getting hearing aids or treatment for their children?
There are, I think, two barriers. One is, of course, price, budget, and the other is stigma, cosmetically. So most of parents usually ask for the hearing aid which cannot be, which is totally discreet, which is impossible in small ages, like less than 12 years of age, because in small age, a patient needs a hearing aid which goes on the ear, which is called behind the ear hearing aid, and this is visible to everyone. So there are two main reasons. One is budget and the other is cosmetic.
What changes would you like to see the most in the healthcare or education system to better support deaf children?
In Pakistan, at the moment, most of medical universities are offering allied health education system, in which there is an audiology education, bachelor's and master's. So I think in these times, all universities, the medical universities, health sciences universities, are offering audiological education. So there is no issue in Pakistan at the moment.
All right. What advice would you give to students, school, or communities who want to help improve the lives for deaf children?
First of all, the most important thing is the awareness. So the people who are living far-flung areas, they don't have those facilities, those clinics around their cities, around their native areas. So they usually have to come to the metro areas like Islamabad, Lahore, Peshawar, Karachi. So the most important thing is they don't have those awareness that their children is requiring a hearing aid. And then they need to get used to it, that he will use the hearing aid for the rest of the life. So the most important thing is the awareness only. And we those clients which are dealing like us are normally creating awareness campaigns in those areas, like free camps activities and other activities like the camps activities.
Alright. Thank you so much for sharing your insight with us, and your experience has really helped with us understand challenges and solutions related to deaf children's education and daily lives. Is there anything else you would like to add?
No, I think the most important is the patient should immediately contact to a clinic which provides the hearing assessments. The most important thing is the hearing assessment. The hearing assessment determines if there is any need of hearing aid or not. So sometimes most of patient comes with the problem that there is a blockage in the ear. There is no hearing issue because of any nerve related issue. There is a blockage in the ear and that is causing the hearing problem. So we recommend them to go back to the ENT doctor, and the ENT doctor make sometimes do a small surgical procedure, and the children without hearing aid is normal. So the most important is to immediately contact and go the relevant clinic and get the required treatment.
Alright. Thank you again for your time.
Most welcome. Happy hearing.